Up to 15% of men and 40% of men who are experiencing infertility have something called a varicocele. I'm Dr. Justin Houman, board-certified urologist and male fertility specialist, and I'm here to discuss everything you need to know about a varicocele. So what is a varicocele? A varicocele is when you have enlarged veins within the scrotum that creates blood pooling around the testicles. And what's the problem with that? When that happens, that can negatively impact the testicular function. It can present with pain, it could present with hormone issues or low testosterone issues. It could present with infertility or testicular atrophy. Those are probably the four main reasons or four main results of a varicocele. Think of it like plumbing, where blood is supposed to go back to the source, but it doesn't. So as a result of that, blood pools in an area where it shouldn't. Varicoceles are most common on the left side. However, we do see them on the right side and in many cases bilaterally. The way it's diagnosed is through a bear down technique or Valsalva. We have a patient bear down and that helps blood pool around the testicles, and in doing that, we're able to feel if the patient does have a varicocele on either side. If it's what we call a subclinical or mild varicocele, we can order a scrotal ultrasound, and that gives us the exact diameter of the vein that's dilating, giving us an accurate diagnosis. And again, about 15% of men have some form of a varicocele and 40% of men who are experiencing infertility. So it's way more common than you think. As I mentioned, there's 4 symptoms associated with a varicocele. Number 1, infertility. Number 2, testicular pain. Number 3, having some form of abnormal hormones, low testosterone specifically. And number 4, testicular atrophy. We're going to start off with pain. Varicoceles cause a unique type of testicular pain. It's more of a dull, achy pain that gets worse throughout the course of the day, and in many cases it resolves when you lie down. So as you can imagine, when you spend more time on your feet, more blood pools around the testicle. As a result of that, you get that dull heaviness, but that does resolve when you lie down. About 2 to 10% of men report this type of pain associated with a varicocele, and when we do the varicocelectomy, about 75 to 85% of men report that their pain has improved after the procedure. Varicoceles and fertility. This is where it gets interesting. A varicocele can negatively impact fertility because more blood pools around the testicle, therefore increasing testicular temperatures, causing oxidative stress to the sperm and DNA damage to the sperm. What's the impact of this? It could really negatively impact your chances of natural conception or even IVF. The varicocelectomy can improve semen parameters by more than 80% in men, which again can really increase your chances at natural conception or if you're using IVF. And more importantly, even for men who have non-obstructive azoospermia, which means they're not producing any sperm, the varicocelectomy can help improve their chances of it having some sperm in the ejaculate, or if they even need a sperm retrieval down the road. When to treat. So a varicocele can cause any of the 4 things we talked about. It can cause testicular pain, infertility, testicular atrophy, and abnormal hormones. So not all varicoceles need to be fixed. But if you are a male who's experiencing some form of infertility and you have a varicocele, my recommendation generally is to fix the varicocele depending on the severity of it, which can only improve your fertility rates down the road. And the impact of a varicocelectomy in terms of when you will see the positive effects on your semen analysis is about 3 to 4 months after the varicocelectomy. When it comes to testicular pain, as I mentioned, about 2 to 10% of men have some type of form of testicular pain associated with the varicocele. So in those situations, when we do the varicocelectomy, a lot of times about 85% of men will improve some form of or maximum resolution of their symptoms, specifically the pain that is associated with the varicocele. When it comes to hormone imbalance, the data here is not as good, but if a man does have abnormal hormone levels and there's no other identifiable cause where a patient may not even want to be on medications in order to prove those, we can have a discussion with them in terms of discussing what a varicocelectomy can do to improve their hormone rates. So if you do have a varicocele and you have any of those symptoms, it requires a good discussion with a reproductive urologist to see if it does make sense for you to fix it. How do we treat varicoceles? So the gold standard treatment is what we call a microsurgical varicocelectomy. This is done with a small incision in the groin area. What we do is we use a surgical microscope that can magnify it at about 25 times, and we're able to see every little part of the spermatic cord, which is where the varicocele exists. Within that spermatic cord, you have those varicoceles, those large dilated veins. You have the testicular artery and the vas deferens, which is the tube that carries sperm back to the outside world. So in those situations, we're able to closely identify those veins, tie them off, avoiding any damage to any of the surrounding structures, and in doing so, really eliminate that varicocele and essentially address the symptoms that brought you into the operating room. The microsurgical varicocelectomy is the gold standard because it has the highest chance of success with the lowest recurrence rate and the lowest chance of causing any damage to the other structures because we're using a surgical microscope and we're able to see every little aspect of that spermatic cord, again making sure there is no collateral damage to the healthy structures. Varicoceles are way more common than you think. As I said, about 15% of men have them. 40% of men who are experiencing infertility have a varicocele as well. The earlier you address it, the better off you will be. If you have any testicular atrophy, testicular pain, infertility issues, abnormal hormones, do see a reproductive urologist who could look into this to make sure that you don't have a varicocele. But even if you do, the earlier you address this, the better. A varicocele will never get better on its own. It will either get worse or stay the same. The earlier you see a reproductive urologist, the earlier we can intervene, and ultimately you have a better chance of success when it comes to the varicocele. I'm Dr. Justin Houman. Follow along for more evidence-based information on male fertility as well as men's health.